Thanks for joining us today on Amazing Milestones. I'm Tara, I'm your host, and today we're going to talk about what to expect during pregnancy. With the help of our expert, we will go step by step through each trimester and talk about what you might be experiencing. There's a lot to cover, so let's get started. Hi, Dr. Benoit.
Hi.
Welcome to the show.
Thank you very much for having me.
Oh, thank you for being here. So first off, I want to know, what physical changes can a woman expect during her first trimester?
First of all, I have to say that all women are different and they do experience different things in pregnancy. However, in general, many women do experience breast enlargement and increased sensitivity during the first trimester. Afterwards, a lot of women do experience a lot of fatigue at the beginning of the pregnancy, as well as some nausea, some vomiting, especially during the first trimester.
Well, let's talk about that. Why do we experience this morning sickness, and when does it start, and especially what can we do about it? Because I know it can be really hard for a lot of women.
So basically it can start as early as the woman knows that she's pregnant. Morning sickness can happen anytime. Often it's in the morning, but some women do experience it all day long, unfortunately for them, exactly. And it's mainly during the first trimester because the hormone levels, the pregnancy hormone levels are at its highest. And a lot of things can be done about it. So sometimes it's just eating small meals or snacks here and there. Otherwise, some women do take vitamin B6, which can help, as well as some ginger. Otherwise, there's some prescribed medications that can help as well.
Okay, getting back to the hormones, how else do they affect a woman's body during pregnancy?
So there are many hormones that are increased during pregnancy. So basically, the progesterone is increased, causing the fatigue that the woman feels. The pregnancy hormone is increased, causing the nausea, the vomiting, kind of a feeling of being different. And then other hormones can affect constipation, as well as heartburn and different things.
So leaving the first trimester, entering the second trimester, hopefully we have more energy, no more nausea. What can we expect in terms of physical changes?
So basically in the second trimester, what's interesting about it is that the women starts experiencing the baby's movement.
Yay.
So start feeling this, so that's a good thing.
That's a great thing.
Usually the energy is back a bit more. However, the belly starts to grow, so sometimes there's some associated abdominal pain with this time around. And then some women do experience constipation as well as heartburn and things like that.
Well, another great thing, besides feeling the baby move, which is wonderful, is that glow that you often see in women during that second trimester. So what is happening to our skin at that time?
I believe that the glow is more about the happiness of the women at that stage, from what I know. However, there are some women that do have better skin during pregnancy, secondary to all the different hormone changes. However, some women do experience acne and things like that during pregnancy.
Well, do you have any specific tips for women that are entering their second trimester?
Basically, the main things that the women have to do is to eat healthy, drink a lot of water. So we recommend 3 liters a day of water. Otherwise, it's very important to exercise regularly. So we recommend moderate exercise for at least 30 minutes a day. And otherwise, the regular checkups with her doctor is very important.
Okay, well, thank you very much. That was really pertinent information on the first and second trimester, but this is all the time we have. So join us next time when we continue our conversation and explore the third trimester of pregnancy. See you then.